And you're taking a moment to hear what our guests have to say this evening. I have Dr. Mukhisa Kituyi, who is a former cabinet minister, here in studio, and Wanja Maina, who is a new media expert, but also an active citizen. Good evening, both of you.
Good evening.
And Daktari, we've seen your statement about different issues of, especially touching on education at different levels. But the cabinet has issued a statement sort of saying that things are actually okay, all the way from the economy to matters management of health. What would you say?
If a person says to Kenyans today that things are okay, that person lives abroad. They do not know what Kenyans are feeling. If you face the situation of young men and women who are uncertain whether they're going to sit exams next month at university or not because they're being asked to pay money they don't have, they can't tell you things are okay. If you asked parents today about the uncertainty of a changing education system without resources and facilities, making children in public schools not competitive compared to those going in private high-cost schools. You tell them things are okay, they say you don't know what you're talking about. If you have seen what is happening with the deindustrialization of Kenya, enterprise migrating to neighboring countries, and you say that we're comfortable because we're exporting our labor, when you should be growing Kenyan labor for Kenyan enterprise, and you tell them things are okay, you live abroad.
And Wanja, very strong responses from the Minister of Education, Minister of Health, as well as the National Police Service this evening on all the questions raised by both the press statement by the Catholic bishops, but also the political class led by the Na Kenya party leader, Martha Karua. So where are we, if you're to compare all these statements that appear to be not in agreement?
Thank you very much, Sam, for the invitation. You know, the Catholic Church, according to the Kenyan census in 2019, we have over 9 million Catholics in Kenya. The Catholic Church is one of the churches that has worked in one of the remotest places in Kenya. In fact, in some places where I've worked, like in some rural areas in Samburu, when the Catholic priest is going to the outpost to make their Catholic Mass, they go with mahindi, maharagwe, and the Catholic Church is often, sometimes perceived to be some form of government. They have educated children of the very low-income areas, and therefore they are at the pulse of the people and at the pulse of Kenyans in low economic means. I don't know why this government has formed a habit of being reactionary, defensive, and at war with the people they lead. When we talk about the issue of social health, SHA, SHIF, or whatever they call it, I mean, even though you say that it's working, are you marking your own exams? If Citizen TV has gone to Nakuru, like the story I saw, which was very sad, a 75-year-old man crying, saying that he has nothing to do. Why should I believe a press statement from the Ministry of Health, yet I can see a man who needs dialysis?
All right.
You know, some of these things are very urgent.
All right.
An individual who needs dialysis is an individual who cannot pee. Dialysis is a life-saving exercise that is done to an individual for 2 to 3 times a week so that they can wash their urea. This is an individual whose body is just upside down.
All right.
I mean, it has to work for those people. So for me...
All right. And just to note that the day after the coverage of that gentleman, action was taken the following day, and we understand that he got help after the government.
But how many others? How many others?
Of course, we'll be talking about that later on with our panelists here. They'll be joining the News Gang team later on, so stay tuned for that. But now to another story. The University of Nairobi